As we mark 2 centuries, and that's just a tough word to say, 2 centuries of medical care to this community, it really means what we really are about, which is service to others. The hospital's foundation was built on taking care of those who no one else would take care of. And in 1823, our hospital, then called Marine Hospital, was founded to care for the sick and the injured river boatsmen, workers who were coming down the Ohio River and had to stop before the falls. They were dropped off because they were sick and had no place to go, and that's where the original Marine Hospital was based of. It became Kentucky's first hospital, and over the next 200 years has remained at the forefront of innovation care, compassion, breaking down access barriers, and teaching. And that says a lot. Again, it's our mission to help those in need. We've grown into the state's largest academic health system, and we're building the future today. As you look outside, you'll see a $180 million expansion of University Hospital so that we can continue to meet the needs. The investments will allow us to modernize the hospital and to meet the needs of the community. I want to honor all those who have served at the hospital over the last 200 years. We have 1,300 associates today, and what you do every single day is what makes me proud as a CEO to represent you out in the community for what you're doing.
I got to start with a story this morning. I was on the phone with a colleague of mine early this morning, and we're talking about some business stuff. And he says, "Oh, Ken, before we leave, I got to say happy birthday." So my birthday's next month, and so I didn't think much of it. He said, "Happy 200th birthday," and I said, "Mike, I don't feel that old yet." So, but he was talking about us. I took a second, if you don't mind, to reflect on, what makes a place last 200 years. And that's as Tom mentioned, that's a pretty incredible thing. If you look around at all of the accomplishments that we've done in the last 200 years, put them all together, it's a pretty remarkable story. And there are about 3 things that are common when I look at what makes an organization last. The first is it's a place where people are cooperative, and it influences what they do. If you've ever had the pleasure of seeing our staff at work, that's in existence here. It's a place where there is a purpose, and it's a place that doesn't rely on a single individual. So in short, it's bigger than any one individual. And it's a place that can be depended upon. Isn't that University Hospital, and isn't that the thing that makes this institution last? I wanted to share with you how I've seen this in action and what gives me confidence that our purpose will survive another 200 years. I tell this story to new employees, and some of you have heard this story already, but I think it bears repeating. So if you've heard it already, please don't roll your eyes. Because I think it really is the essence of what makes us who we are. And it was, Tom tells me I've been here longer than dirt. I haven't, but it was about 30 years ago. I started my career here in healthcare. And I was about 2 weeks on the job, and a colleague and a friend of mine had the unfortunate opportunity to use our services. It was an icy morning. He was taking his kids to school, and he hit an ice patch. And he was brought here. His children were taken to Cosair, and I got a call from our chaplain that said, "You might want to come over and to our emergency department." So I went over, and I saw 2 things that stuck with me that day and live with me every single day. And that was, first of all, I saw what I expected to see and what many of us in this room have seen, and that is just this skilled professionals doing what they've been trained to do, taking care of a severely injured person who was clinging to life. Second thing I saw was what I did not expect to see, which was their innate understanding that of all who come through our door, don't come through as an injury or an illness, that they come through as a human being. And they understood that they were helping a father and a friend and a part of his community, and they understood that in their heart. And it stuck with me and sticks with me. I think about that story almost every day, and it gets me up and it gets me through the times that are difficult, because we all have them, the times that are rough. So I think it keeps us focused on our purpose and helps us face the moment that we have, because they're not all perfect. So happy 200th anniversary to everybody here. I have to say thank you to all of those who are caregivers in this room. I want you to stand up because we need to thank you most of all. You bring that purpose to life every day. And while I don't think I'm going to be here to celebrate the next 200 years, feel pretty confident, I'm sure it will be breathtaking. So thank you very much.
It is great to be in Louisville, Kentucky today. A place that Brittany and I called home for 15 years. A place where our kids were born. And a place last Tuesday that came through with about 70% and over 100,000 vote margin. So thank you. And it is wonderful to be here with each and every one of you today celebrating the 200th anniversary of UofL Hospital. That is 200 years of you caring for people. 200 years of courage that I've seen firsthand and compassion. 200 years of living out a calling that is healthcare that I saw in the most difficult of times when for about 2.5 years we walked through the gates of hell and back together because that's what people needed. I saw your courage walking into COVID wings when we did not have the PPE we needed. I watched your resilience when some went from calling you healthcare heroes to other names I won't repeat. They called me that a lot too. But we would not be here today in the place we're in without 200 years of great care, but incredible care these last 4 years. We talk a lot about adversity we've faced over time, things we have been through in the last 4 years. Wow. You all have done such phenomenal work in the most pressing and difficult of times, and for that, I will always be eternally grateful. And I think what 200 years is in terms of achievement, I don't have my birthday next month. It's in about 15 days, though last Tuesday I felt about 200 years old. And what it means for how much this institution has driven this city and this Commonwealth forward. I want to thank our leaders here today, Tom Miller and Ken Marshall, and it's great to see our new president, Kim Schatzel, again here today. You're doing a great job. I'm so excited about everything you're bringing to this university. I'm thinking about Mayor Greenberg. He's now about 10.5 months on the job. Really good things are happening. We were just celebrating a headquarter location here in Louisville and now celebrating healthcare. Good jobs and healthy families are what's going to continue to drive us forward. I want to thank Orville Blackman and Dr. Jason Smith. We have spent a lot of time together these last years. Thank you for your leadership, both in the medical and in the moral field. Very grateful for you. And yes, I did take that shot in the arm, but I watched him do it first. You are not just advancing trauma care, you're also pursuing cutting-edge research in so many important areas like childhood cancer. We've supported U of L's research through the Pediatric Cancer Research Trust Fund Board, and in my next budget, I will be proposing a record $15 million to that fund over the next 2 years, the largest by far. I've also got to celebrate with you as you became the first verified burn center in Kentucky. And so, yeah. In addition to increasing care options, you've been a major contributor to Kentucky's success because healthcare is not only essential in getting our families healthier, you are economic development itself. Every time you make that $170+ million investment, every time you grow, you add good paying jobs. And as we know, we're creating jobs so quickly. We're going to have a good job for everybody we can get trained enough, educated enough, and yes, healthy enough to fill. And so just imagine what we can do together as you continue to get people healthier. And not just to fill the jobs that are out there, not just to supercharge our economy, But with that many jobs, what we can do to combat generational poverty, to restore hope where hope has been lost, a real chance to meet this moment in the moral way and to get it right as we move forward in this county, in this city, and in this Commonwealth. Since taking office, I've joined U of L to celebrate the creation of more than 565 new jobs for our Kentucky families. I've gotten to be there for the hoisting of the final beam at the South Hospital in Bullock County. How many lives that's going to save by decreasing that ambulance drive. The $21 million investment, 140 jobs at U of L Health Fraser Rehabilitation. Of course, this new $144 million project, 325 new jobs. That is exciting for this corridor. And just to hear the mayor's plans for this area of investment, of advancement, is so exciting, and it would not be happening but for U of L's investment and for all of the good work that you all have been doing for so many years. I feel really blessed to know you and to have worked with you. And we're going to keep pushing forward on the policy side to help make sure that you can help more people. That's everything from the second day when I was in office that I rescinded that very cruel Medicaid waiver that would have kicked 100,000 people off their health care. It's the expansions in Medicaid to cover a full 12-month postpartum period, as well as to provide vision, hearing, and dental services to help boost our workforce and people's quality of life. It was when we relaunched and expanded Connect. The sign-up period is going on right now. Make sure you remind people that are out there. It's working with the General Assembly to pass legislation that's provided more than $2 billion additional dollars to our Kentucky hospitals. It's launching the 988 mental health lifeline. My goodness, the calls are getting answered faster. More people are getting direct care in that most critical time by those like you that are trained to help the most. We are saving lives daily, thanks to that new hotline at a time where I think our world and our Commonwealth needs it more than ever. And I was proud to sign legislation that capped the cost of insulin. We have a lot more to do and a lot more to go on prescription drugs. No one should ever have to choose between putting food on their table, paying their heating or their cooling bill, and whether or not they can afford to pay for their prescription drugs. But folks, just like this first 200 years, I'm only halfway too. And there is so much that I look forward to together. What you all are doing right here, downtown, and in every one of your areas is special, and it's going to make us better. Now, we've got a chance, I hope, coming into these next 4 years where our economy is booming, where we're seeing investments like this, when we're seeing true advancement, when we're getting picked over and over by the biggest companies and opportunities in the world. They're picking us when they used to pick somebody else. That means we have got a chance to build a better life for all of our kids, an opportunity to leave more opportunity for the next generation than many of us ever thought was possible, and this is such a big piece to that puzzle. So our job, I think, in the coming years is to push out all the noise, all the division, all that other stuff that's out there, and try to truly live out our state motto, which is as old as our state, 231 years ago, December, right after our state had been about 5 months old, we adopted that united we stand, divided we fall motto. It has stood with us as long as we have stood here. And there may have been a lot of moments that we haven't lived up to it the way we need to. But the opportunities moving forward, if we can just remember that we have more that bring us together as Kentuckians. We have more to look forward to. We have more potential in front of us to reach and to grab, I'm telling you. We can move forward at a pace that we had never thought was possible, and we can do some really special things together. So, happy 200th birthday to U of L, to the special role that this hospital plays, and to every single healthcare hero, and I love you. That pandemic was real. Oh, I can say it. I've been saying it. But what you have done for us, I can never fully put into words. But as long as I'm in this job or walking on this earth, I will stand right next with you, beside you. I'm so grateful for what you've done. God bless.
It's my pleasure to be here and celebrate with everybody. I'm kind of the newish, we call me the newish president at the University of Louisville. I can't say new anymore. I've been here since February. And I have to tell you, when I was looking at this position and looking at this university, I came home to my husband after I talked and I said, I got to get this job. And the reason was the relationship with the city, the relationship with U of L, and how much this institution means to the Commonwealth as well as to the city. I came here and I met a lot of people. I went to Peace Hospital, I went to South Hospital, I went to University Hospital, Mary and Elizabeth, to be able to get to know people because I served on the board. I wanted to talk to the nurses, talk to the staff, talk to the docs, to be able to learn more about what this incredible institution was all about. And they shared with me stories and challenges and the gifts that they bring to the community and how much that community meant. I've talked to a lot of folks that have been educated at both our nursing, our dental, as well as our medical school. And I can tell you, when you talk to people as they've spread out across the Commonwealth, but also across the nation, that they will tell you that the professionals that we educate and that we train are different. And they're different from exactly what Tom says, because compassionate care is at the root of what this institution as well as U of L is all about. So I am incredibly proud of the partnership that we've developed. I'm incredibly proud of the fact that we work together to be able to advance those goals and to be in the city of Louisville, in the center of where we are right now in terms of downtown, and to take a look at what's happening. You can just feel it. It feels different because of the fact that all the people here are committed to this community and committed to each other. So I can tell you the fact that research that's performed, I spent times in labs like last week where people were putting stem cells in cardiac cells to regenerate those. And it's going into clinical trials to be able to do it. It's amazing what we're going to see out of these two institutions partnering over the next 200 more years, Tom? It's possible there. But I want to also say the fact that the heroes are right here. Absolutely right here. So the heroes are right here, stepping forward, stepping into spaces, saving lives, as well as providing that compassionate care is what makes this such a special place. And it's a place that I feel so blessed to be a part of and to be able to share with all of you. So thank you very much.
If you're a new-ish president, I guess I'm a veteran mayor now at 10 and a half months. But thank you. It is wonderful to have you as a partner, to have a governor, a current and future governor who we know is going to continue to prioritize care, love for everybody, and science over the next 4 years. Our state is in amazing hands, Governor, and we are so happy with last Tuesday's outcome and so excited about the next 4 years ahead to continuing to partner with you, U of L Health, the university, all the healthcare heroes, and so many other great people and organizations around our city. You know, as I was thinking about today, our city's talking a lot about a big anniversary we have coming up next year, and that's the 150th Kentucky Derby next May. But today, I'm realizing they don't have anything on University Hospital here, on U of L Hospital. I mean, 200 years is absolutely amazing. I mean, 200 years ago, that was 5 years before the first mayor of Louisville was even in office. 200 years ago, our population here in Louisville was just a little over 4,000 people. But we were growing at that time. More people were coming to Louisville than ever before. And the year before the hospital opened, we as a city had just endured a malaria epidemic. And it was clear that as a growing city, we needed to find more ways to provide care for our population and for folks who were traveling through the city. And that care is the need that the hospital was created to fill at that time. And as you've heard so much about today, it is so wonderful and amazing to see how that care continued for 200 years, and we know that that care is going to continue. Just as our city will continue to grow and evolve, so will U of L Hospital continue to grow and evolve with a strong mission dedicated to caring for others that are in need of health care and in need of love and support that you all provide so many ways. And it is so great to have that strong partnership with this hospital, because as the governor talked about, whether it was COVID and the amazing care that you all provided, whether it's the trauma that people are enduring every day in our city, and you all as one of the early leaders in trauma care across the country, and also when it's gun violence that we are seeing far too often in our city, to have the leadership of folks like Dr. Smith, who are here to provide that great care to patients and to great services to families in their darkest days. We are so fortunate to have UofL Hospital. And when we think about the future of our city, UofL Hospital is going to play a critical role in partnering with the university, with our state, with the city, and other public and private organizations. We are working hard to address the homeless crisis that we're dealing with here, and UofL Hospital is a great partner on that. As the governor talked about earlier, we have an amazing new initiative here called LUMED. The University UofL Hospital is right in the middle of that, alongside the university and your ambitious plans also, which I hope the state also continues to fund, to make LUMED, the Louisville Medical and Educational District, the campus where there is a focus on care, on research, on education, and a true engine for economic development. We in the city will continue to invest in this. I know the governor supports that as well. And so we are so excited to continuing partnering together with you all for the next coming years, the next 200 years, because we can, as we continue to partner together, we will be sure that Louisville is a safer city, a stronger city, and definitely a healthier city. Congratulations, and thank you all very much.
We want to first acknowledge our distinguished guests and our senior leaders, and we want to acknowledge you, our team members. What a great salute to those of our team members who have been here 40 years or more. Can we give them another round of applause? The focus on diversity, equity, and inclusion has grown across the country recently, as it should. It wasn't always called that, but the idea of equalizing access to care and the opportunity has been a part of UofL Health for a long time. It started from the very reason the hospital was created, to ongoing commitment to serving the medically underserved today. So here are a couple of examples that we want to look at. We located one of our newest primary care and urgent care centers in the Parkland neighborhood with a physician who wanted to return to his hometown to serve. We know that access to primary care is a healthy foundation for a healthy life. And what's extra special about one of our own, Dr. Jamal Ritchie? He's from Parkland neighborhood. He grew up there and is now taking care of his friends, their families, and neighbors. And he's but one example. We want to inspire more young people who have already got talent and just need opportunity to be a part of this neighborhood, to be a part of this city that allows us to contribute at higher levels. That's why we have continuing partnerships with schools like Central High School and 10 other high schools in JCPS, Oldham County, and Bullitt County to identify and recruit others who we could train and develop. We want to inspire future doctors and nurses and social workers and allied health professionals and all of the other team members that make hospitals work. We want to invite them into our community to help us develop those around us who are still yet underserved. It is also why we launched our free tuition program for our employees and their immediate families. We now have more than 550 employees attending UofL, the university, with tuition paid. And it is why we're committed to investing in an inclusive culture here at UofL Health, providing ongoing diversity, equity, and inclusion training through our Academy for Inclusive Excellence to all of our employees. It helps with patient care, and it helps with employee engagement and advancement. Equity and inclusion have obviously evolved over 200 years, and UofL Health is committed to be the leader in this area to ensure everyone has access to high-quality care, just like we did when we first opened the hospital in Kentucky, to make sure that everyone could get access to the care they need. Our diversity initiatives also target more than 20 dimensions of diversity, including people of all racial, ethnic, and religious groups, our veterans, the LGBTQ+ population, people with disabilities, foreign-born residents, and more. Kentucky is one of the largest refugee settlement areas and provides opportunities for us to serve our growing diverse community. We at UofL Hospital and across the UofL Health Network are serving more and more of these new members of our community. And we are delighted to encourage them to be a part of our community as we provide high-quality care. We're committed to expanding our outreach services and engaging in conversations with our community groups to ensure that we understand and are equipping ourselves to better serve their specific healthcare needs. We are delighted to continue this work that was started over 200 years ago. Happy anniversary.
I asked Sherry Kreshmer to join me up here. You know, I laughed. We kind of did paper, rock, scissors to see who would be talking and representing some of the clinicians. I won't tell you who won, but I'm talking. Yeah, and I think you've heard a lot of great stories. I will tell you, I'm also acutely aware that I'm the last speaker today before we get to go have some refreshments, so I will try and keep this brief. You've got a lot of great pictures today, and you're going to see pictures of the buildings that really have epitomized, you know, UofL Health for 200 years. The Marine Hospital moving into the City Hospital in Louisville General, and then finally the hospital we're in now. And we have celebrated births, we have mourned deaths, we have taken care of people of all walks of life for 200 years. They've walked through our doors, and we have taken care of them. But that's just 4 walls. And there will be 4 more walls one of these days. We're going to add on to our 4 walls. But what makes the difference in this organization for 200 years are the people that walk through there, that give up their time, their lives, and their efforts in order to care for their neighbors, their families, the people that live within this city and this community. For 200 years, people have walked in, the physicians, the nurses, respiratory therapists, healthcare workers of all shapes and sizes, our environmental service workers. They've all walked into an environment that is oftentimes difficult to work in. They walked in and caught patients in some of their most dire moments. They have walked into situations that you couldn't imagine, and they have done it with aplomb. They have done it hand in hand with each other in order to support this community, and that's what makes UofL Hospital and UofL Health so special, because you don't find that everywhere. And I can tell you, coming from not Louisville, although I have been here 16 years, you don't see that everywhere. And that is what drew me to this very institution 16 years ago. It wasn't the bricks and mortars. It wasn't anything other than the fact that when you met and talked to the people in this very institution, some in this room today, you could see the dedication they had for the people they cared for, because they knew that no matter what happened, they were going to be there for their neighbors and their family. And they expected the same of each other, and they held each other to that standard. So for all the nurses, all the clinicians that are here, all the workers in this hospital that work in the clinical care environment, for all the people that supported the firsts that this hospital has seen, I want to say thank you for your efforts. You are the reason we are here. You are the reason we will keep going in this city and this landscape. So with that, thank you all very much.
Thank you.
Thank you, everyone, for your service, and appreciate celebrating 200 years of this.